Melissa Kirsch, and myself, Brandon Petty. In this presentation, I will be discussing the objectives, definition of Crohn's disease, incidence of the disease, and risk factors for developing Crohn's disease. In our next slide, we'll discuss the objectives of Crohn's disease, and for this presentation, the learner will be able to define Crohn's disease with 90% accuracy. The learner will list 2 risk factors that are common with Crohn's disease. The learner will identify 2 ethical concerns and the treatment options for Crohn's disease. And continuing with the objectives, the learner will be able to verbalize 5 complications associated with Crohn's disease. The learner will be able to discuss plan of care in treating or preventing complications with 90% accuracy. And last objective, verbalize how Crohn's disease can affect the patient's family life with 90% accuracy. In the next slide, we'll discuss the description of Crohn's. Crohn's disease is an inflammatory bowel disease that causes inflammation of the lining of the digestive system. The inflammation associated with Crohn's disease can cause inflammation in different areas of the digestive tract in different people. So one person, it could affect their mouth and throat and esophagus. The next person, it may affect their small intestine. The next person, it may affect their large intestine. And then you may have another person that their whole digestive tract from their mouth all the way to their large intestine is affected. And this disease was discovered by Dr. Burrell Bernard Crohn and his 2 colleagues in 1932. In which the disease is named after Dr. Burrell Bernard Crohn since he came up with it. In the next slide, we'll discuss the incidence of Crohn's disease. The incidence of Crohn's disease ranges from 10 to 70 per 1,000 people. And that's a pretty big variable right there, 10 to 70. There's several different samplings out there that suggest different things. Some surveys in North America have shown the incidence to be as high as 200 per every 1,000 people. The peak age specific incidence occurs between 10 and 20 years of age. So most of the people that are diagnosed with Crohn's are between 10 and 20 years old. Also in the U.S., both females and males are affected equally. So right now, studies show that both males and females tend to get Crohn's disease at about the same rate. Some risk factors for Crohn's. The first one is age. Most people develop the disease before the age of 30 years old. So if you're younger than 30, you have a bigger risk of developing Crohn's disease. The second one is ethnicity. Whites and people of Eastern European descent are at the most risk for developing Crohn's. So all the studies right now show that if you're white and you're of Eastern European descent, you're more likely to develop Crohn's than other races. A family history is the third risk factor. And as many as 1 in 5 has a family member with the disease. So that goes to show that this disease is more than likely hereditary. The fourth risk factor is cigarette smoking. And cigarette smoking leads to more severe disease and a greater risk of having surgery. So if you have a patient that smokes cigarettes, they're at a greater risk of developing more severe inflammation with Crohn's and also a greater risk of ending up having to have surgery in the future because of the disease. The fifth risk factor is NSAIDs. Everybody knows what NSAIDs are, things such as ibuprofen, and these can lead to worse inflammation of the bowels when taken with Crohn's. Of course, these medications can cause inflammation of the digestive tract anyway, so if you already have a disease that causes inflammation, this is one thing that you want to avoid, which is NSAIDs. The last risk factor is where you live. Studies show that people who live in urban and industrialized areas are more likely to develop the disease. And this also goes to show in studies that the disease is higher in the northern part of the United States than it is in the southern. And that just goes to show that there's more industrialized areas up around the north part with all the factories and plants, such as all the car factories around Detroit and the plants around Chicago and factories. There's more incidence of Crohn's in that area over the U.S. than there is in the southern U.S. Next part of the presentation will be done by Lauren Kelly, and she will be discussing pathophysiology of Crohn's disease, common symptoms and signs of Crohn's disease, and diagnosis and prognosis of Crohn's disease.
Recording.
Thank you, Brandon. My name is Lauren Kelly. I'm also an RN to BSN student at MEW, and this is my portion of our Crohn's presentation. I'm going to go over a little bit of the pathophysiology, the signs and symptoms, how it's diagnosed, and a little bit about the prognosis. So let's get started. The patho is actually not really known exactly, but based on some laboratory findings and clinical findings, they do think it's genetic or it has genetic relation, and also the environmental factors contribute. So there are some theories though, even though they don't know exactly what it is, and they're listed up here for you. Autoimmune response to luminal mucosal antigen, dysfunctional immune response to some kind of bacterium in the GI tract, and then also an infection which just causes chronic inflammation in the GI tract. So here's a picture of some of those theories there for you to see. The unfortunate thing about this inflammatory bowel disease, Crohn's, is that it infects the entire GI tract. So it can go from your mouth to your throat to your esophagus, into your stomach, your small bowel, and your large bowel. So it's a little bit more difficult to treat just because it affects the entire GI tract. So that kind of makes it different from, like, say, ulcerative colitis or some of the other inflammatory bowel diseases. This is just a diagram showing all the parts of the GI tract that can be affected by Crohn's. There are a lot of debilitating signs and symptoms associated with Crohn's, like severe abdominal pain. You have a lot of diarrhea, so a lot of Crohn's patients, right after they eat, they have to find a bathroom, so it can be a life-altering diagnosis. But some of the other things are fever, fatigue, can make you, just really tired and take a lot out of you, blood in your stool, that can be kind of scary for some patients. So, a lot of education on these things when people get diagnosed is very important. Also, loss of appetite and a lot of weight loss. These patients can't gain weight just because whatever they eat, generally comes right back out. So it's really hard for them to keep weight on. So there's a lot of different ways that Crohn's is diagnosed, and they do a battery of blood tests, some of which include a CBC, which would just show if they were anemic, because of the blood in the stool and all that. A lot of your intestines can bleed from this. The CMP would be for your electrolytes and everything, all the imbalances that diarrhea and that kind of thing can cause, and just loss of appetite in general. The fecal occult test would show if they were actually having blood in their stool, which is the sign of an acute flare. And then there's many diagnostic tests. Since it affects the entire GI tract, as I said before, they use anything from endoscopies to colonoscopies, sigmoidoscopies, then there's MRIs. They can do a CAT scan of the abdomen and pelvis. And then to look at the small bowel, the best diagnostic test would be a barium swallow, which they drink this really awful stuff. It's very thick. And and then they have to get a battery of x-rays, and it just kind of shows the bowel and where the inflammation is. And most Crohn's patients, I would say, are affected at the ileocecal portion of the bowel. So that is one of the main tests. And then in some cases, patients have to go through biopsies where they biopsy the actual affected bowel, and they can diagnose it that way. But generally, they don't have to do that. They can get it with the diagnostic test. So, living life with Crohn's, actually, they can thrive with this disease. It's not a disease that causes a large number of deaths or anything. Most deaths from Crohn's come from complications. But anyways, they would do diet modifications, of course. There's plenty of foods and everything that they can stay away from or eat in moderation, like spicy foods, real acidic foods, things like that they can stay away from that help be able to live with the disease a little easier. And then, of course, smoking cessation. Smoking's been shown to cause flare-ups and patients with Crohn's disease. So, just a lot of education on smoking cessation is important. Of course, stress reduction. Stress causes a lot of bowel problems anyways, but in Crohn's patients, it definitely can cause flare-ups. So just teaching ways to reduce stress and, also exercise programs are really important for these patients too, just to keep their weight up. Here's just a picture of some of the foods that you might want to educate your patients on that they can eat and that they might need to stay away from or eat in moderation. I know a lot of real acidic foods and everything are definitely, they want to stay away from in this disease. So, treatment, in addition to the lifestyle modifications we've already discussed, there's different medications, and the medications are based solely on what part of or how bad the flare-up is. Patients with Crohn's, but since it is an autoimmune disease, can go into remission. So with that being said, when they're in an acute flare situation, they might be prescribed antibiotics for the infection part of it, and steroids to help reduce inflammation. And then those that they need to be on long term would be the immunologic drugs and the biologics that they could be on long term, and that can put them in remission. And not to be redundant, but since it does affect the entire bowel, surgery is definitely a last resort because they can go in and surgically remove the affected area, and then this disease can come back right next to it. So they try to control it and to put you in remission without having to do surgery. So that's definitely a last resort. And this subject is really near and dear to my heart. My husband was diagnosed with Crohn's disease back in 2014, so I've really learned a lot about living life with Crohn's and kind of become an advocate for it and wanting to spread the word that you can still live a happy, successful life. My husband, he works full-time and everything with his Crohn's, and he is on a biologic called Humira, and it does keep him maintained. So just a little encouragement for that. There are complications that can arise from Crohn's, and my friend Melissa, my partner, is going to go into her portion of this PowerPoint presentation on the ethical issues as well as complications. So I'm going to go ahead and turn it over to her, and welcome, Melissa. Thank you very much for your time.
Hi, I'm Melissa Kirsch, and I am going to present the last portion of our Crohn's disease presentation. As you've learned from Brandon and Lauren, there is no cure for Crohn's disease. There is research ongoing, and oftentimes patients and doctors face ethical issues in treating Crohn's patients. Research requires that clinical trials be done on human subjects. This is an issue ethically because the patients don't know the short-term or the long-term effects that this research will have on them or their disease process. Stem cell transplantation has been researched. One ethical issue in this is that Crohn's is not a terminal disease and so does not meet the requirement for stem cell transplantation. Also, the research that has been done on human subjects showed really no definitive answer. Some patients did go into remission. Some patients had complications from the procedures themselves, and some patients actually had negative outcomes to their disease process. So it's really unclear how stem cell transplantation affects Crohn's patients long term. Physicians are often hesitant to try risky strategies with Crohn's patients. These patients become desperate after years of dealing with symptoms and basically willing to try anything. And due to this, the physicians feel that the patients may not always be thinking clearly, and they hesitate on trying anything very risky on these patients. There are challenges to coping with Crohn's disease. It is a lifelong disease with no cure. Patients who are diagnosed often deal with depression, they feel angry, and they feel sad due to this diagnosis. The frequent flare-ups are unpredictable and can interfere with scheduled events, vacations, family life. Crohn's disease is painful and debilitating. These effects put a strain on the patient's physical and emotional health. Crohn's disease affects the patient, but it also affects the entire family. Often patients with Crohn's disease are unable to work, therefore they are unable to financially contribute to the household. This can be very frustrating for the entire family. Some patients deal with frequent hospitalizations. It's hard on the family when a family member is in and out of the hospital frequently. The frequent diarrhea can be a huge embarrassment for the patient and their family members. Pain and diarrhea interrupts family time. Often the patient will isolate themselves due to their pain and their diarrhea symptoms. Most patients will need some type of surgical intervention within the first 10 years of diagnosis. Treating Crohn's disease can be very costly. Patients oftentimes pay copays for visits to the doctor. Those copays can range from $20, $50, depending on the patient's insurance plan, and can be even higher if the patient is uninsured, up into the hundreds. Also, diagnostic testing such as blood tests, colonoscopies, and x-rays can be very costly. The first treatment course for Crohn's is typically drug therapy. These drugs can vary in cost, as low as $20 a month, and can go higher into the hundreds depending on the medication. Surgical procedures and hospital stays often become the norm for patients with Crohn's disease. Top 10 problems associated with Crohn's disease. These are listed with the most severe as being first. Crohn's patients have an increased risk for developing colon cancer. They develop fistulas, bowel obstruction, ulcers, anal fissures, abdominal pain, diarrhea, depression, malnutrition, and weight loss. Plan of care for severe Crohn's complications. The risk for colon cancer does require that these patients have regular cancer screenings, and usually it is more frequent than those without Crohn's disease. They just need to consult with their physicians directly on the frequency of these screenings. Fistulas. At the first sign of a fistula, a patient needs to seek medical attention. Fistulas can be life-threatening, and they often require surgical intervention and are very difficult to heal. Bowel obstruction. Patients oftentimes will need multiple surgeries in their lifetime, so they want to weigh surgical intervention with great care. But trying to prevent bowel obstructions, they need to follow their diet. Of course, don't smoke, get regular exercise, and those things can all help to keep the flare-ups to a minimum. Ulcers. There again, to hopefully prevent the development of ulcers, follow the low residue diet that's recommended for Crohn's patients. Anal fissures. Due to the frequent diarrhea, Crohn's patients are often at risk for developing anal fissures. They need to keep the anal tissues as dry and clean as possible and treat the diarrhea as directed by their physicians. I hope you've enjoyed our presentation and learned something about Crohn's disease. Please complete our questionnaire. Thank you for watching.